in South Surrey, Whiterock, Cloverdale. I'd like to speak to you for a few minutes about healthcare in Canada and the needs of Canadians across the country universally. Healthcare in Canada is a central pillar of Canadian society. Access to all is a fundamental, almost perceived as a right. But there are challenges. Well, Progressive Canadians promise an honest commitment to the Canada Health Act and Medicare. We are committed to ensuring sustainability of the Canada healthcare system in all of Canada. An aging population, ever-increasing costs of medical technology and of pharmaceuticals place strain on healthcare systems worldwide. The answer for some is to decrease access through privatization or introducing private insurance systems whose primary purpose is to achieve profits at the expense of those most vulnerable. Progressive Canadians fully support the Canada Health Act and its principles of single-payer, publicly funded and administered, comprehensive health care that is available to all Canadians equally, wherever they live in Canada, in all of Canada. Progressive Canadians make an honest commitment to maintaining and sustaining the principles of the Canada Health Act, Medicare and public health care as a key part of Canada's economic strategy as well. It's the Canadian advantage. When seeking funds for investment in industry, we often find that choices are made which favor places where the costs of doing business is lessened by the costs of decreased health care. In this last decade, General Motors, even before the recession, reduced up to 25,000 American jobs in the auto industry based simply on the cost of health care. It is interesting that they did not make the same cuts in Canada, but the Canada health care system allowed private business to escape that cost. Accessibility wasn't lost with layoffs, as happened with General Motors. We did not see people losing access to health care because they lost their jobs. They lost access to income and their circumstances changed. Nor did they confront the possibility that with a change of employment, that a new insurance company would say there are pre-existing conditions for which you are not covered, or deny you coverage, or cause you to be charged more. That problem does not exist with the universal system. Part of our solution as Progressive Canadians derives from our legacy as the legacy party of the Progressive Conservative Party in Canada. We called then for long-term, stable, predictable funding in order to allow the provinces as administrators of healthcare delivery and publicly funded healthcare to plan rationally, fund healthcare, research and development of healthcare information technologies while working with the provinces to address the need for better access to healthcare in rural Canada and plan for future home care and pharmaceutical needs. And the latter two aspects are parts of regimes that could be described as aspirational. They are things to which we must work. But the other aspects are more easily addressed. Better health care in rural Canada requires more access to physicians who are willing to work in areas of depressed economies or in rural or distant parts of the north. This could be addressed much as we do with the Canadian Officers Training Corps, by which young people are allowed to have their income, their tuitions paid for in exchange for a period of service in the Canadian military. Well, why not have the same application made for service in rural and depressed areas in the far north? It seems only rational. Progressive Canadians want to continue this path. We want to add to it recognition of the need to address issues which were not apparent when the Canada Health Act was written. For example, and particularly, the need of families confronted by a seeming epidemic of autism spectrum disorder, ASD, now affecting 1 in 110 Canadian children. Why not make it possible for those families to be able to access health care just as we would as if they had cancer? As a first step, Progressive Canadians promise an honest commitment to the Canada Health Act and Medicare. But we have to do more than that. We have to be committed to perceiving Canada as a whole, not as 10 provinces and 3 territories, each struggling towards their own ends. We can do that by restoring the level of funding that was decreased over the last 10 years as challenges were placed on the federal government for other purposes and other resources and other priorities. Why not make health care the priority it was when we established the Canada Health Act itself? I think this is a challenge we can meet. Now, the Progressive Canadian Party isn't going to form the next government. You know that. But what we can do as members of Parliament is work vigorously to form coalitions, to form alliances, to form and persuade other Canadians, other members of Parliament, to grasp our vision and to be the burr under the saddle of those who would decrease in access to health care. We can do this because we care. I thank you for your time. Yeah, that was a challenge.